I'm now very fortunate I'm speaking to Dr. Walter Moloi, physician nephrologist at the Gaborone Private Hospital and board member of the South African Hypertension Society.
Thank you very much.
So, for high blood pressure, also known as hypertension, that's the number one cause of preventable death worldwide. My first question is why does people don't actually speak so much about that stat?
Yeah, that's true. It's unfortunate that we don't talk as much about hypertension. It's one of what we call the non-communicable diseases, the diseases that people have that are not from infectious causes, and they are mainly associated with lifestyle. And unfortunately, they kill a lot of people, but they don't kill as fast as many people at the same time as you see with things like COVID, HIV. The problem with non-communicable disease, we call them silent killers. You spend years with the disease before it causes the ultimate insult, which is death for most patients. So that's why actually people don't really talk a lot about it. There's not a lot of messaging out there about this condition, but it's the number one cause of death globally.
So, if my 13-year-old daughter who does lots of tasks here at home and tests, if she had to come to me and she asked me, Daddy, what is hypertension in the simplest form? What is it? Is it just simply blood pressure or not?
We can simplify it to say that usually when you say high blood pressure, there's a weight pressure there. It means that there's pressure somewhere along the body. So basically, when you say hypertension or high blood pressure, we refer to the pressure that is exerted by blood as it's pumped by the heart onto your blood vessels. Blood vessels are like pipes where blood moves to give nutrients and take out toxic waste from the body. When this blood is moving under high pressure, it exerts a lot of pressure on the blood vessels. I'll give you an example. If you take a tap and you connect a pipe to it, if you increase the pressure of the pipe, there's a more water pressure coming out. When you narrow the pipe and then maintain the pressure from the tap, the pressure increases at the end. So imagine now when you have blood vessels becoming smaller as we age, and then the pump is still pumping the same way. So it means the pressure will increase. Now you are damaging the inner wall of the blood vessel. That's when now blood pressure becomes a big problem.
So, what would be the signs to know that you have got hypertension? How would anyone know that they have?
Most people walk around with hypertension. They don't know until a complications happens. A complication for some people can just be a heart attack. You have a heart attack and then you never get out of it. It could be a stroke, you get paralyzed or you die from the stroke, or you actually have kidney disease, what you call chronic kidney disease, when now your kidneys are damaged by the blood. Some people have symptoms that will lead them to thinking that there's hypertension. Some complain about headache, and the headache may be one of the presenting features of elevated blood pressure. Or some people say, I can't see properly. Their vision becomes distorted. You check their blood pressure, it's high. But again, when you go back to the definition of blood pressure, we say blood pressure that is elevated, but consistently elevated. So remember, sometimes you can have a high blood pressure, not because you have hypertension, but because maybe you are in pain. The pain sensation can cause your BP to go high. You check your blood pressure during that time, and the blood pressure is high. It may not necessarily mean that someone has hypertension. It may just mean that there is an insult that has led to an elevated blood pressure. If you recheck blood pressure once you have addressed the pain, you may find that the blood pressure is actually normal. So hypertension, by definition, really has to be an elevated blood pressure that is persisting over a long period of time, not just a once-off reading that is actually high and then you call it hypertension. So that's one of the key things that we need to look at to actually differentiate.
Doctor, who are the prime candidates to get hypertension? My heart rate rises when I watch football on a Saturday, but on a serious note, who gets it in general?
Yes, unfortunately, hypertension can affect everyone from children all the way to adults. And general teaching was that it usually affected people who are the age of 45 more than those who are younger. But due to lifestyle changes that we see, now we are having younger people developing hypertension, but more prevalent in the teens, in the 20s, and in their 30s. It's very, very important that everybody actually sees themselves as being at a risk for developing hypertension. One of the things we do in medicine, when you have hypertension, we classify it into primary hypertension, secondary hypertension, or other types of hypertension like pregnancy-induced hypertension. Primary hypertension was mainly for the elderly people. And then if you were younger than 40 and you had hypertension, we thought you could be having secondary hypertension. We had to look for those potential secondary causes. But because of the lowering of the age of primary hypertension, we found that people who are younger have the hypertension that we would rather call essential or primary hypertension, which means that it's related to lifestyle and aging. So you are at risk.
Doctor, what is the role of genetics? Does it play a role in whether you can become a candidate to develop hypertension?
Yes, so the genetics do play a role in the development of hypertension. One of the biggest studies that looked at hypertension, we call the Framingham study, they looked at the risk of hypertension within families. And what was found was that if you have a relative who developed hypertension before the age of 55, there's a higher risk that their siblings or the third generation siblings would also develop hypertension, even when you look into all the other factors that we know are risk factors for hypertension. So hypertension really, yes, has a genetic component to it, but there are also genes that we know that if a person has it, it can be transmitted from generation to generation, and it carries the risk of hypertension. And one of those is the that was actually studied in Cape Town by Professor Rayner and Prof. Jones, where they identified a gene among the population called the quiescent population, people who have the quiescent inheritance. They can have a gene that increases their risk of developing hypertension. So when they come in with hypertension, we need to look specifically for that gene. If we can find the gene, we can find the right medication used to treat their blood pressure. That's a bigger role that we actually see with hypertension and the genes.
That's fascinating, doctor, I have to say. And I mean, when we talk about anything preventative when it comes to blood pressure, I know what you're probably going to say. Exercise, follow a good diet, avoid alcohol. Am I correct?
Yes, yes, yes.
So it's not all doom and gloom then, doctor, because surely you can have your blood pressure diagnosed and tested then.
Yes, so that's the good thing about hypertension. It's one of the conditions that can be prevented through lifestyle measures. If the genetics are not a factor, but also we can pick it up early and then we can institute treatment early and control it early to prevent the complications thereof. The most important thing for us to do is everybody must always know at any point in time what their blood pressure is. So at least once a year, if you don't have hypertension, you need to know, at least check your blood pressure, see what your blood pressure readings look like. You know, the blood pressure readings, we could call them as there's a figure at the top and a figure at the bottom. So you must know those figures. The HIV advocacy group have done very well. They were able to teach their patients what to look out for in the setting of HIV. If someone is HIV positive, you know, they're on treatment, the only thing that they need to know is that what is my CD4 count? What is my viral load? So those are the key numbers that they always know. And you ask any patient on treatment, they will tell you. For hypertension, the most important factor is the blood pressure reading. So we need to make sure we teach our patients about what does the blood pressure readings mean. There's a figure at the top and the figure at the bottom. We have two figures for blood pressure because the blood pressure we measure is the pressure that comes from the heart as it pumps. Remember, the heart pumps, as it pumps, it contracts. There's a pressure that you see at the top. And when it relaxes, preparing for the next pump, that's the pressure at the bottom. That's why you always see 120/80. It's important that people know what their blood pressure readings are at all point. And if blood pressure is elevated, the institute measures to control it through medications or lifestyle measures.
Doctor, do you see a rising trend in hypertension in South Africa?
If we look at the global statistics, the first world, there's a trend towards a decline in the incidence of hypertension. So the number of cases of people with hypertension are decreasing, and the number of new cases of hypertension are also decreasing in the first world. But if you look into low to middle income countries like West South Africa and the rest of Africa, we are seeing a different trend with a rise in hypertension. So there's a high increase in the number of people with hypertension, but there's also an increase in the number of new cases of hypertension on a day-to-day basis. And one of the most damning statistic that we find about hypertension is that majority of the people with hypertension in South Africa, in Africa, 50% of people who actually have hypertension that you see on a day-to-day basis don't know that they have hypertension. And even smaller proportion of people with hypertension are on treatment. Very few are on treatment, and then very few on treatment are controlled. And generally in Africa, the number of people with hypertension who are on treatment and controlled is about 10%. So which means that there is a lot of people out there with hypertension who don't know they have hypertension. So the numbers that we look at, we say these are the numbers of hypertension. Usually it's a tip of the iceberg of what the bigger problem is, which is why we actually tend to get into activities where we try to increase more testing for hypertension so that we know what the readings are in the community so that we pick cases early, we prevent the complications of hypertension.
So did you think a change in overall diet to a more Western diet with more processed foods as attributed to the stat that you just shared with us?
Yes, if you look at there's a trend, lifestyle has changed, and I think like key things that have happened, especially in the African continent, people are moving from rural areas more to cities, and with that, there's a change in lifestyle in terms of diet. People are becoming more sedentary in that they spend most of their time sitting. Even if they actually go to work, they don't exercise. They no longer do heavy duty work that actually gets their body to work out. And then they also change their eating habits. There is an increase in the amount of sugar that we eat. And remember, no sugar contributes to weight gain. There's also an increase in the amount of salt that we eat. If you go to the food outlets, you find that most of the food there is very, very salty. The problem is that when you eat a lot of salt, salt helps you, it keeps a lot of water in your body. Imagine what happens to that pump when we keep more water, it means that you have more blood. So you have to pump more. So your blood pressure goes high just because you took in a lot of salt. So salt can now become one of the biggest contributor. And weight itself is also a risk factor because when we gain a lot of weight, it means that more work the heart has to do to pump more blood to perfuse that body. So there are a lot of factors that are related to how we live our lives that increases our risk of developing hypertension.
So, doctor, I understand there's a yearly commemoration of hypertension, which means that there should be more awareness. So, how does it happen, and what is the theme for this year?
Yes, so the World Hypertension League, it's a league that actually oversees a lot of work on hypertension. It is that there's actually this big problem of awareness for hypertension. So the Institute came up with a commemoration day that happens every year, the 17th of May. The theme for this year is measure your blood pressure accurately, control it, live longer. So which means that if you can measure your blood pressure, not just to measure it. There's a certain way that we advise that blood pressure should be measured. And it's very controversial. I think a lot of people now are looking into new gadgets that you pick up. Let's say you just put on your wrist, it tells you what your blood pressure is. And then there's some say your phone can actually help you get your blood pressure. Most of those devices have not been validated to measure blood pressure. So there are standardized ways of measuring blood pressure where you have a cuff. It has to be a right side cuff. Like I told you about the pain, that when you have pain, your blood pressure will go up. So it's to measure it properly, we mean when we measure it, we must make sure that it's measured in the right context. If you've been running and you come and sit down and I check your blood pressure, it's going to be high, it's going to be a false reflection. If you drink caffeine, drink coffee, and then I check your blood pressure, it's going to be falsely elevated. There are certain things that we need to make sure we look at for us to say we've measured your blood pressure accurately. So measuring it alone is not enough if we are not going to control it. So if it's high, we need to make sure that we control the blood pressure. Most important thing is lifestyle for most patients. And then after lifestyle, then we have to add up medications in view of which ones is appropriate in that context. And the other part of the theme is live longer. You know what? Hypertension is one of the biggest killers in the world. So which means that if you can control hypertension, you actually help a lot of people live longer, which is a huge benefit.
Doctor, what I've learned now about our diet, fitness, and all the things that we never think about that influences how you feel and influences your blood pressure, it has really given me food for thought. Doctor, thank you for this wonderful and insightful conversation. I, for one, will be taking my dog out more for a walk just to keep my blood pressure down. That was Dr. Walter Moloi, physician nephrologist at the Gaborone Private Hospital. And once again, thank you to Sandoz, Servier, Pharma Dynamics, and Zydus for the unconditional support. As the doctor said, measure your blood pressure accurately, control it, and most importantly, you can live longer. Visit your local pharmacy, clinic, or medical practitioner. And to learn more about hypertension, top tips for healthy low blood pressure, follow the South African Hypertension Society on social media or visit www.hypertension.org.za.